So thanks for joining us. My name is Clint Bodily, and the reason that I am the person doing this, some of you know me, I am a Manikin guy by trade. I cover the states of Utah, Nevada, and Alaska. I'm a field sales representative. Those of you who don't know me are probably not in the states of Utah, Nevada, and Alaska. So the reason that I got kind of picked to do this is, as people in Utah, Nevada, and Alaska know, we have group meetings fairly often, fairly frequently. And with the whole COVID-19 thing going on, we've been doing virtual meetings instead. We've just kind of moved and tried to keep helping you online. So we appreciate everybody coming out. Thank you for all the sacrifices going on. I know there's a lot going on, definitely in the healthcare world, pre-hospital, nursing schools, trying to keep students moving forward. So that's why we're doing this. We want to let you know where Laerdal can help you. There's a lot of ways we can help you that you may not know, and any ways that we don't know, we want to help you. But before I go further, due to current CDC guidelines, I had to update this slide. So let me fix this. That's better. So again, the reason I'm doing this, and even though you don't know me, is since we have a platform to do this in Utah, Nevada, and Alaska, we figured we'd invite the entire West Coast and anybody that's in need or anybody that might benefit from some of the free scenarios, the online training, the online service that Laerdal offers now. We wanted to include everyone. So those of you that are online right now, you're essentially with your peers from Alaska, clear down to San Diego, east to Arizona, and up to the Canadian border. We got Utah, Montana, Idaho, Washington, everybody's here. Along with me, we have all sorts of Laerdal staff on the meeting today. So you may recognize some of these people. We have these are all the representatives, inside sales and outside sales in California. All of these people, just like myself, are here to help you right now. Everything that we go over today, your individual reps will be able to give you information on, hook you up, be able to help you out. We're going to go over a lot of information. I want everyone to rest easy, let you know that we're going to send handouts out at the end of this meeting. So you can take copious amounts of notes, but we're going to make it easy on you, and we will send you some handouts. Those will come from these people you're seeing here, your reps. And we have all the other states on as well. So whether you're in Washington State with John Rayfield, whether you're in Arizona, Oregon, or California as before, we've got your back. So why are we holding this meeting? I covered a little bit of it, but we're all stuck at home, but everyone still needs to keep the lights on. We're all going to be asked to do things. We've got mannequins we've got to keep track of. We've got to fix things. All of a sudden, nursing students didn't have clinicals. How are we going to make that up? People have got to graduate. We've got to update software. Some people can get in their buildings. Some people can't. You get the idea. Training's needed. I'm getting people calling me all the time about this kind of stuff. Clint, can you help me train on my SimPad? Can you help me write a theme? I've been tasked to implement simulation with our curriculum and our syllabus. I don't know where to start. We're getting all these kinds of calls. Medical staff are definitely stretched thin with what's going on with the virus. And we've actually had a lot of calls Laerdal wide as far as, are there scenarios to deal with COVID-19? Is there training? Is there going to be anything? The short answer to that is yes. We're going to go over some of that today. But the main reason we're holding this meeting is this last one here. All of us are going to be expected to hit the ground running once COVID-19 goes away. And I know I speak for all my colleagues when I say we're here to help. And literally, if there's anything we can do to help you, we want to do it. And we're going to let you know today some of the things we can do. You might be surprised at some of the things we can do to help you. So this is a really busy slide with a whole lot of stuff going on. And I kind of did this on purpose because everything you see on here are things that I've had calls about just since we've all been home. I had one yesterday. There's a little BLS provider card right there in the center. We have some med schools that are requiring their students to have a BLS provider card, as many nursing schools do as well. And now that they're shut down, they're saying, well, how do we get BLS provider cards? Well, one of the things Laerdal has is a program many of you are familiar with called Heart Code. And you may or may not know, we can help your students do their cognitive portion of the Heart Code at home. And where there's a will, there's a way. We even have instances where we can loan you a Manikin and you can certify from your kitchen table. I personally did my BLS about 6 months ago, and I was doing compressions and ventilations on babies and torsos on my kitchen table. So it can be done. Over here, Manikins, pieces, stuff. People were receiving things before we all got sent home, and there's parts laying around all over the labs. How do I put these together? What do I do? Where are my orders? All these things. Over here, more mannequins. People are saying, well, I was trying to train the staff on how to use Nursing Annie, then we got sent home. How do we do that? Over here, you're getting the idea very quickly. Our AV system is down. IT's not available. I'm supposed to have this up and running. My mannequin's head fell off. You sent me this computer program. I don't know what you're talking about. What's this scenario cloud thing? Over here, I was helping a person online the other day assemble a mannequin. And then I got this picture from someone that said, welcome to my current lab. So you get the idea. Bottom line is all of the Laerdal reps are available. We can help you with all this stuff. Whether you need a suction unit right now because you're desperate in your hospital, whatever it is, we can help you. And today we're going to give you some real help. We're going to give you some tangible substance. So live online personalized training is now available. That's one of the things that we sent out in the invite. So in the past, when you've had mannequin training, you've had someone come out to your facility, walk you through all your mannequins. We can do that online. So we have a couple ways to do that, and we'll go over that in more detail today. But suffice to say, any training you need on a mannequin or a Laerdal, excuse me, or a Laerdal product, we can show you how to do that online. We have COVID-19 themes and pre-programmed scenarios available. They are free, and we're going to show you how to get them, and we're even going to go through one today. So everyone who's on this meeting will be able to get that material. We will show you how to load that material onto your control devices. So we're not going to go into it to great detail today, but we're going to show you a COVID-19 theme and a scenario. And then we're going to show you how do you take this thing and actually put it on your device. So we'll get you started. Then online mannequin service is now available. This is brand new, almost breaking news as of a few days ago. So what this is those of you that have things that are broken, or I've had some Simtacs calling me from home saying, I'm trying to fix this mannequin board. I'm trying to calibrate the IV arm in a mannequin, whatever it is. We have people who can, we have service technicians who can help you do this virtually. And let me make sure you're all seeing my screen. I'm going to do a new share just to be sure. Okay, everyone should be seeing a slide that says you will get help today. Okay, just making sure. So services, basically we have the ability now where you could be anywhere you are, at home, on the internet, as long as you have access to voice and video, whether you're Skyping, FaceTime, whatever it is, we can literally get a Laerdal service technician with you, and we can help you update software. We can help you troubleshoot a problem. We can't physically do nuts and bolts repairs online, obviously, but we can get you as close to that as possible and also give you next steps for how to do those repairs when that's available. And Laerdal's depot is still running, so there is the option to ship mannequins in for repairs. But again, not to go too long here, we're going to give you handouts about all this at the end of it. And the reason I showed you those slides earlier with everyone's happy faces smiling, we want to let you know we're all here. We're all online. There are no dumb questions. There are no minute needs. Anything you need, please do call us. We will help you. If it's, like I say, UPSing you a torso so somebody can certify BLS from their kitchen table, we'll do it. If it's just updating software, teaching you whatever it is, we got your back. We have two experts online with us today. I want to introduce them. There's the old saying, you know, they wrote the book on that. Well, these people, some of you may have met them. We have Kelly McKeever online today. That's Kelly there on the left. We have Lori Kurtz on the right. Those of you who've had mannequin training before, you've had someone come out and they teach you how to use your Sim Baby, your Sim Man, whatever. Then they leave you with a nice textbook that tells you how to use it, has screenshots and everything. Well, Mr. Kelly McKeever is the guy who literally wrote the book on that. So he is going to walk us through the COVID-19 scenario today and talk a little to that. Lori Kurtz was our educator of the year. And she basically, you've probably met her too. She is going to help us figure out how to put these themes on your SimPad and your computer. So with that, I will turn it over to Kelly.
Okay, thanks so much. And again, good morning, good afternoon, and good evening to wherever you may be hailing from. My name's Kelly McKeever, as Clint has indicated, and I am an education specialist for Laerdal Medical. And my job basically for you today that Clint has tasked me with is to illustrate 3 points by and large. And the first is, of which is just basically to say thank you to the healthcare workers of the world who are on the front line fighting this this current disaster that we're all going through. Just to let you know that we think of you as the true heroes of the event and want to thank you for serving your families, our communities, and society at large. So thank you for joining this. And what we're going to do past this point is talk a little bit about our virtual offering and delivery capabilities, and then perform a quick demonstration of a LEAP scenario and a SimPad theme, just to give you an idea of what it is that we can do for you on multiple fronts, as Clint has mentioned. From the standpoint that we can train you to run scenarios, we can show you what has been built out in the world. Some of you have mentioned that you would like to learn how to program some of this stuff yourselves. These are all elements that we can actually address, but we want to give you some working examples of a real world type of a situation, just simply because I think it's going to be relevant to your situation. So stand by as we go through all of this, and let me just visit again some of Clint's points on why virtual training in here. And again, one of the things that virtual training is going to provide, and it can't provide everything, but it can give us a jump start, and it can actually allow us to teach you certain things that don't necessarily need to be done face-to-face. So we think in terms of convenience and scheduling, we try to hold our courses or our offerings typically to no longer than about 2 hours in length, just to allow you for more preferred dates and time slots. We can run these pretty much all day. We can run these pretty much all night. And it really just depends on the demand. If you want something and we can actually build something for you, we're more than happy to deliver it when it's convenient for you. We also know, as far as practical classroom settings are concerned, virtual training, the big advantage of it, or one of the big advantages of it, is it can be piped anywhere there's a laptop, a tablet, or a phone. And we understand that today's learning environment demands flexibility, and so do you, and so do I. So we want to make sure that we have something that's going to meet that demand for you as well. So once again, on-demand training, it's what you want when you want it. So if there's something particular that you need, and again, the world really dictated that we get out in front of the COVID-19 virus situation, which is why we created the scenario that we're going to give you access to today. These things occur at light speed, and we want to be able to meet that demand as quickly as it's merited. So in addition to that, as far as what you want when you want it, we think this lends to the efficiency of your training as well. Again, we're not saying that virtual training is the end-all, see-all to everything, but it does lend well to a blended approach, meaning that some of the stuff that we can give you obviously is going to have a much larger advantage in terms of virtual training, but some of this we just still want to remain our face-to-face footprint as well. Face-to-face training, again, just can't be substituted from, again, in certain circumstances, such as physical attributes of the mannequins and things of that nature. But we have ways to bridge this. So we know that some of our lessons can be delivered just as efficiently via virtual means. The ability to show you how to navigate LEAP, to navigate your SimPad, software demonstrations, programming aspects, those are all right there at your fingertips. So what do we have kind of in the back burner right now? And I'm going to draw your attention to the right side of this slide here. The available 2-hour courses that we have built. We have been starting to create a catalog of coursework for the customer base at large. And here are the things that we heard. We didn't build these things inside of a silo. We built these things based on input from you. And again, we're going to ask you to give us a little bit more of an idea a little bit later on as the presentation goes on. But we know that's what out there right now. We can do 2-hour simulator orientation sessions for you folks. If you want to just get started with something in terms of your mannequin, we can show you what the physical attributes are. We can show you how to operate the mannequin, and then essentially it's a great place to begin for you. And again, as I mentioned before, the platforms or the operational platforms that we do have from our SimPad and LEAP platforms, we can show you how to operate those. We just need to kind of share a desktop and off we go. Simulation strategies, which is essentially an introduction on how to organize and produce a simulation and essentially lead it, and then lead it right on into debriefing after that. And then our first programming aspect that we do have in a catalog sense right now is creating themes. We do have more of these on the docket, and I'll show you a little bit further down the road what those are, and then ask you for some feedback if you wouldn't mind as well. So taking over to the left-hand side of the screen here, this is essentially the platforms or how we're going to produce these or get these out to the public. And the one that we're essentially ready to go with right at this moment is the group virtual classroom training. And what this is going to be is this is basically a business-to-business model. If you are a healthcare entity or if you are a school, this is how, if you have purchased training from us in the past, this is exactly what it would be right now as well. So if you purchase the training, we will come to you, we will create an outline for you, we will make sure that we transfer a meeting link so that it's just one instructor in front of your learners, your specific facility. The one to the left is, once we get this one up and running, we're essentially going to create a catalog of courses based on the offerings at the right. But we'll put those out and establish those on like Fridays, Wednesdays, and fixed time frames so that we can allow 25, 26 different learners in. So the left side is more kind of a webinar approach, whereas the right side over here, the group virtual classroom training, is yours and personalized. So again, you can kind of look through the slides. This is being recorded so you can see the features of each of the classes as well. But just for time's sake, I'm going to keep this relatively short so that if you need to come back and review it, you can. We're also going to plan a Q&A session for you so that you may ask any kind of questions based on the prices and the organization. This example here, we do understand that some of you out there already have courses that you have purchased, and a lot of them, again, this is just kind of a partial list of what it is that we've been asked to react to and courses that you have already purchased. Well, we know that there's been limitations on face-to-face training, travel, sheltering in place, orders, and things of that nature. So what we want to do is illustrate here that all of these courses can basically be converted to from an on-site experience into a virtual experience. And essentially, how would we go about doing that? Again, would be once you make contact with us, and if you do have interest in converting some of that training into a virtual experience, contact your CE, your sales associates in any respect that you possibly can. And once they're alerted to it, they'll get a hold of us in the education services areas, and we'll start to take the ball from there. So again, kind of lining up what it would be that you want us to do, what are your objectives, what it is that we can best serve. Again, typically when our on-site trainings are purchased, 1 day basically equals 8 hours of training and education. So what we're going to do with that is, if you are interested in converting this to a virtual experience, we'll take that basically hour for hour. So customers, again, provided with the flexibility to convert your on-site training to virtual, we'll convert it to 8 hours of virtual training, and we can organize this according to your schedule, what works to you or what works for you. So again, if there's interest in this, just contact your client executive or account executive, and we'll kind of take the ball from there. Now, how are we going to deliver this to you? So this is what it looks like basically where I'm sitting at the moment. This is a virtual lab buried in the middle of Dillon, Montana. And Janet Coe, I see that you're on, so we're not too far apart up there in Butte. So just to let you know, we're still alive down here and all is well. So for those of you who don't know, again, welcome to Laerdal, Montana. And we have a full service simulation lab or a virtual remote simulator lab that we can pipe any of this information to you that we need. So we're fully equipped with mannequins and information. And again, from this point, just a fully functional teaching environment. We've got a couple of different camera views that you can see on the left that's being recorded by a sim capture system to help any kind of debriefing. And again, we can pipe that information to anybody that needs it. And then, of course, my leap station to the right and the wonderful, luxurious dog bed right underneath my feet for my beagle when she comes to, of course, help me teach classes and such. So we're ready to serve you. We're here to be able to do this for your needs and the needs of your classes, your students, your colleagues, and so on and so forth. So at this point, I just want to let you know that here's coming to a laptop near you. These are parts of our curriculum that are in the build phase at this point in time, and we're working diligently to get this all done. But this is where I would invite you not only to take a look at the list of the information on this slide, but give us your ideas. Yeah, we just can't get enough of this information. So in terms of a virtual need or a virtual delivery, something that we can deliver to you, what's on your mind? What do you need? Put this in the chat. The chat function on all of these meetings and webinars are always recorded. And we have a hard copy of them, but we want to hear from you. Again, there's no sense in building content and curriculum that make absolutely no sense to anyone. So we want to make this relevant to the specific needs, okay? So with that, what I'm going to do is essentially just go through a quick real world contemporary example here. So, but in a nutshell, what we ended up having to do is we developed this scenario and a theme, or well, we developed scenarios and theme files for both LEAP and SimPad based on a peer-reviewed article that was created by 3 physicians at the University of Toronto. We did this, the first delivery was to the world on, it would have been St. Patrick's Day, the 17th of March. And essentially, this is just kind of a retracing of that presentation, just to show you a couple of things. It's an example of how simulations can be produced very, very quickly in response to like a current event. Some of you have mentioned things of the nature that you need to get your students back into the clinical environments to get credit for clinical experiences and things. And again, simulation can be, in certain circumstances, substituted for some of that clinical experience or clinical time. And what we want to do is make sure that you're at least ready to deliver that. So we can produce these things relatively quick. And again, just kind of on an on-demand need. You tell us what you need, we can make these for you, or we can show you how to make your own, and which is, I think, a little bit more of a stick in terms of making sure that you can do this at any time in the future. So the other thing, again, just to make sure that we understand that this can be produced quickly in response to any kind of a circumstance, it's also a really good example of what we can do in terms of your virtual training. So we always have to kind of precede this. Anytime that we talk about medicine and the progression of any kind of a medical simulation, we have to disclaim it. So essentially, without reading this word for word, any training resource that Laerdal provides is just not going to be a substitute for this advice provided by healthcare professionals or other healthcare professionals. Folks should always follow their internal policies, procedures, protocols as such. And again, we just have to kind of line that out to make sure that we're not hanging out in the wind. So essentially what this case was, this peer-reviewed case, and you will have a copy of this, as Clint said, in a handout section toward the end of this training. We'll make sure that you have the exact article that we used to build this. Essentially what it is it was built in January of 2020 this year. So we know how much, not necessarily the assessment, but actually treatment is tending to evolve with these COVID-19 patients and such. But this one actually deals moreover with the screening and donning a PPE, so on and so forth. So this was screening. We produced 3 segments of webinars right now: screening, treatment, and then kind of advanced treatment with respirators. And all of these scenarios, all of these things are free to you at the end of this webinar. So again, with our build, we had a suspected coronavirus case. The case was designed again in January, just really to assess and improve team readiness to safely and effectively treat a critically ill coronavirus patient. So that's what the case description. Here are the case objectives set forth by the physicians who built this. Again, practicing personal and team safety, assessment, treating a patient with a respiratory-borne illness, requiring full PPE. So medical and crew resource management. We want, of course, effective communication from triage to treatment, mitigating exposure of all of us, which is a huge deal at the moment out in the world. And again, mitigating personal risk by using the appropriate donning and doffing PPE, and then again, conducting any kind of clinical care in a relatively limited space with personnel in limited negative pressure rooms effectively. So again, this was the case. This is not my words. These are the words of the physicians, and I need to be sensitive to that. So when I start to program the scenario file or the theme file, I am congruent with the wishes of the author, which again could be you in this stage as well. So the case flow of this scenario that we're about to demonstrate to you is really kind of a work from a patient or from a standardized patient and transition to a Manikin. So this is where a patient or a person would walk into whatever simulation area that you have. This patient's script is going to say she's 35 years old. She became febrile last night. Cold-like symptoms, productive cough, rhinorrhea, and subjective fever. And again, anytime you see this type of flow with this, I think some of you are probably thinking in your mind, that's not the way certain patients present with this. So another advantage of what it is that we're building for you is that's modifiable. Again, we have to start someplace. So this is why we base our information on peer-reviewed information that we've received from these 3 physicians. However, in the real world sense, all of us who have been simulation educators in the past or right now understand that sometimes the targeted objectives of a CAN scenario just don't meet your specific needs. And in that case, we need to make sure that the scenario file or the theme file is not locked down and allows you to do any kind of modification that you see fit. So that's what we've created for you here. We're going to show you what it looks like, but we're going to make sure that you have the opportunity to change it and make it more along the lines of what it is you specifically need. Okay, so once the standardized patient steps through the door, gives a little bit of a history, and once that history is uncovered, then we move to the Manikin, okay? So once we kind of suspect the coronavirus, we transition to the Manikin, which is going to present in these several states here. So again, with respect to the creation of the simulation from the three physicians, your patient is going to present thusly. So a little tachycardic, BP within normal limits, respiratory rate a little tachypnic, O2 sats are somewhat suspect, but she is alert and oriented to the circumstance. She then starts to deteriorate through the treatment. Once the Manikin basically gets involved, respiratory rate's going to increase, and our saturation levels are obviously going to decrease, which is going to lead to intubation of the patient. Once the patient is intubated, what are we going to do with the patient? Disposition in this case is going to move that patient into ICU and ventilated with 100% FiO2. So post simulation discussions, again, from exposure management to ask the team what they should do now that they're exposed to the potential case. And again, in a hospital, we all have policies and procedures that we have to follow if in fact one of us has figured that we have been exposed. So moving along with this, just to give you one last deal, and I know that this is kind of hard to read, but we're going to put this in a document for you as well. When I go into the demonstration, which is going to be right on the heels of this slide, there are resources that are actually involved with it. So there's a graphic of an X-ray. You will see the ECG in a dynamic sense as it actually plays throughout the case. And then also there's a point of care ultrasound that's active that we placed into the software as well. A potential prop, if you're interested in it, this is actually a kind of a recipe that if you want your Manikin to sneeze and actually have it push particulates into the air, there is a way that one of our customers has built this into a simulator, and we're just going to provide that link for you so you can see how to do it if in fact that interests you in some respect or another. And then the typical references below, and to let you know that there's a great facilitator, what they call a cheat sheet, but again, it's just simply debriefing tips and a sequence of questions that can be offered throughout the debriefing session that are provided by the physicians as well. So very, very well done in a respect. So what I'm going to do is I'm going to pop up and share what the patient monitor would look like as we built this simulation for you. Okay, so when learners step into the suite, they're going to see a picture of Grace and her vital statistics here and a little bit of information from the perspective of what she stepped into the hospital with, or wherever the simulation suite happens to be. Now, from this standpoint, we're going to transition over into what the LEAP platform is going to look like. And then what I'm going to show you how to do is basically run this. So coming back to Clint's slide about what your experience level is with simulation, the intention of the build on this is not necessarily perfection. The intent of this build is so that anyone can run this. All right, so those of you who are experts, those of you who are your cognizance of this platform is a little bit beyond what average would be, you're very familiar with and how to run this simulation from all of these perspectives. So you know what these screens are. However, if I'm a novice or I've never run this before, I may need a little bit of help in doing so. So we've designed this so that it can all be run just solely from this side of the screen here. For those of you who know, this is called an event menu. Over on the left-hand column, these are behaviors and interventions that we are hoping the learners will perform. And I put a column of activities over here to the right-hand side to help you as well, which means if I want an X-ray, I simply have to just click the button that says X-ray. If I want an ultrasound or I want the information from the ultrasound, I simply have to click that button and it actually operates, okay? So those of you, again, just to restate, with advanced capabilities that are familiar with the screen, you can run it however you want. Those of you a little bit more novice and introductory level of folks that are getting into simulation, we've designed this so it can solely be run from this side here, just from this little menu alone. What you see, you give credit to the learners for doing, and if you want the patient to do a few other things or the software to deliver certain pieces of information, that's what's captured here on the right-hand side of the column. So let's move this together and let's start to do a little bit of demonstration here. So the first thing is the patient is going to step in and give us the travel history. The minute they do, we get a pop-up that tells you the patient is short of breath, coughing, febrile, describes the recent event and history of travel into mainland China, returned a couple days ago. She is now getting too weak to walk, and she needs to be placed in the negative pressure room. And then, of course, now we have the Manikin that's going to replace that actor. We simply tell it okay, and then we start to march off. Once the learners perform vital signs, applied PPE to the patient, move her to the negative pressure room, we just click on those events as they do occur. And again, at some point in time, once we call the doc and once we call the infection prevention and control folks, we have maybe the doc orders an x-ray. So I move right over here to where the button says chest x-ray. And when I click on it, it will pop this chest x-ray up, which is a little bit of occluded. And this will pop up on the patient monitor. And to get that to go away, so we say simply reduce the screen from our operation from the leap screen. Okay, we do that just by learner patient monitor buttons here, but we can always close pop-ups from this region here. If you want to know what a point of care ultrasound will look like, we simply push the button. There's the active file, back to our monitor. Okay, so again, one of these things, anytime, if we want the patient to cough, we just simply hit the button and the patient will cough. So again, you don't ever have to go from anywhere over in the rest of the screen. You can just operate this from here. And again, when people take a look at this patient, they're going to say whether or not this patient is actually sick enough for them. So I put a couple buttons in here as well, one for mild deterioration. Once you click on it, you can just watch the vital signs start to change just a little bit, and this patient's going to get a little bit more severe. Okay, and we can always reel it back as well if we want the patient to recover. Obviously, we just have a little button here that helps them recover as well. Okay, so once you're done with the patient, then we can just simply stop it and we can move to the debriefing. And that's about it in terms of the demonstration. So let me pause this, and then I can move back to my screen here just to make sure if there's any questions that we might have that we can address them here. So Clint, if you would please unmute yourself and
I will. Can you hear me, Kelly? We do have a couple questions, it looks like.
I certainly can.
So I'm going to come back up here. There's a question from Stephanie Landers. She says, is there a way to have not just the x-ray, but also a radiology impression included on the x-ray, or text a description of what they are seeing, since students often do not know how to read an x-ray?
Absolutely, and remember that that this case was created by 3 physicians, so it does interpret the potential for providers to be in the room. So there's a couple of ways to essentially meet that objective that you do have, and one of them is either remove the x-ray, or again, like I said, we can create a text box that can be floated over to the patient monitor that can really explain what the learners are seeing. So if in fact they're not qualified to read x-rays, or that's out of their scope of practice, again, you can either remove the x-ray, or there are 2 mechanisms to be able to comment on the x-ray to show learners what it is that they are seeing.
Okay, we have another question. It was, is it possible to host an intermediate or advanced group Zoom meeting and involve IT people? And I can answer that. The answer is yes, we can definitely do that. That can be coordinated through your local rep. And let's see. Here's another one. We have, in this case, are the students just stating what they are doing since they can't be on campus while they're doing this?
We've seen a lot of folks hold what we're, again, what everybody's calling tabletop type exercises as well. So in a situation like this where we have to do the best with what it is that we do have, if we can get next to the Manikin, obviously that's going to be the best case scenario. If you can't, then these things can be created on a Zoom meeting, just exactly what I'm doing here. I can share a desktop, I can show you, again, I can just keep my screen on the patient monitor and start to talk people through what exactly they may be seeing off to the side, or I can play videos up on that screen as well. So what that would mean is that that maybe you show a coughing patient, maybe you show somebody that sneezes with significant particulate expurgation as well. That being the case, you can always give a visual representation of what the physical findings are, in addition to what you can read up on the monitor in terms of the pathophys or the hemodynamics of the case, pardon me. That being said, we should be able to verbally assess, we should be able to verbally recognize, and verbally express our treatment ideas if in fact that's acceptable to you. But there's multiple ways to do this. What I just gave you in terms of an example is a few customers that have gotten hold of us and told us what they're doing. So we just want to cross-pollinate that to the rest of you as well.
Okay, then in the essence of time, we'll just do two more quick ones. One of them is, how does this appear on a sim pad? We are about to cover that, so you read our mind on that one. And there's another one, how do we create a text box that can be floated?
Again, there's two ways to do this. We can create the text box on our own, and I can demonstrate that. I probably won't go into it here, but what I can do is I can create a file that I actually can call a media file. So on the bottom of this, the patient monitor here, I think I can pop that up real quick. Right at the bottom of this, you have three areas. One says radiology, one says media, one says lab. So I can create any kind of a dialogue. I can insert it into these files. And once I click on this, then it's going to pop up like this dialogue here. It's the same principle as how I created the X-ray. It's the same principle of how we created the point of care ultrasound. If I have a file, I can demonstrate that or push it over to the software right here. Okay, so if we need more information on that to do specifics, what I would suggest is you get a hold of me directly and I'll walk you through the steps individually. Anything else, Clint?
There's a couple more I can answer quick. So the part that the students would see is just on the patient monitor. That was a question.
Mm-hmm.
And
Predominantly. Mm-hmm.
Are there x-rays we can use with these scenarios? I'm going to cover scenario cloud in a minute. There's all sorts of x-rays there. And okay, there we go.
Okay,
So,
I'm going to go off mute and I'll stop sharing here so that Lori can take over.
Yep, we'll turn it over to you, Lori. Thank you, Kelly.
All right, well, thank you. And so now I'm going to be showing you how to run the same case study as a theme in the manual mode. So I've got my SimPad up and I would have my Manikin on, I would have my patient monitor on and my SimPad, everything would be on and connected. And I also have a headset attached to my SimPad so that I could speak and answer questions for the SimPad. I'm going to go ahead and go into my manual mode. I'm running a theme and I've got that theme already preloaded on the SimPad. I'm going to go into the suspected COVID theme. And if I wanted to save my log at the end, I could go ahead and put that information in to let me know, and I can upload that log later. But once I'm in the theme, I have states here on the left-hand side. So this allows me as the operator to decide when I'm going to change the patient's condition. So the state can include all the vital signs and any other features that are programmed for that Manikin. So I would stay in that state as the operator as long as I wanted to, and then when I'm ready, I have to manually move from state to state. The other part of the screen we're going to look at is down here under the gloved hand. And that gloved hand is the event menu. So like Kelly showed you in the LEAP software, we can keep track of what our learners do. So every time they do one of these items, I would simply click those off. The blocks across the top are the categories with a list under each. If I'm going to use the categories and the event menu, I want to become familiar with what's in that event menu. As I click them, they don't cause a change to the patient, but they do put a time-stamped event menu in the log so that I can go back and review that during debriefing. So now I'm going to go back to our main screen of the theme, and we're going to go ahead and I would first give my learners that report. So we've just received a 35-year-old woman. She's come in with her fever, cold, and cough and shortness of breath. She does screen positive for the potential coronavirus exposure because she had been traveling to China for business. So as my learners are going into the room, I'm going to go ahead and start the session. And when I start the session, this theme is set up with the states that were specific for that case. So it's going to automatically start in that first triage state if I don't change it. And if I want to keep track of what learners do, I'll go into the gloved hand. So learners go in the room, and I'm going to push and hold the speak button on the side of my SimPad. It's on the right-hand side. It's either a yellow or blue button, depending on which SimPad version you have. And I'm going to answer the questions as the caregivers ask her questions. I can speak for the patient. If I do want her to cough, we do have some preset vocals in the SimPad. So I could either cough my headset, or I can play the pre-programmed coughing that's pre-programmed in the SimPad. I'm going to go back and go into that menu now. So under that gloved hand, I simply just watch my learners and what they do. So if they take her vital signs, I give credit for that. If they apply the personal protective equipment to the patient, I go ahead and give credit for that. If they call the physician in an infection control, I give credit. If they don't do it, I don't give credit for that, and then we talk about it in debriefing. So anything that does, I just give credit here. When the caregivers put on their own protective equipment, then maybe I go ahead and click this more than once. Depending on how many caregivers I have, I can actually use that counter, and it will put an entry in that log for each one. And then when I want to change my state, so now they're going to move that patient to that negative pressure room, and I will change states to the initial assessment state according to the case study. If I want to see what's in that state before I activate it, so it doesn't change until I hit this activate button, but I can always look at it with the little arrow down, the little triangle, and unfold that. I can see the vital signs and any features that are programmed for that state. And in this particular case, I also see there's a 1-minute transition clock. So that means when I activate that state, it's going to gradually move over 1 minute to the new set of vital signs. So I'm going to go ahead and activate that state, and they're going to go ahead and change. Now, my learners are probably going to be putting that patient on a monitor, so they can use that bedside touchscreen monitor and touch to turn on those parameters. Or I, as the operator, could go up to menu and go to the patient monitor. And when I click on patient monitor, any props that they've put on, if they put on EKG leads, I can turn that on for them. If they put on an SpO2 probe, I can turn that on. When they put the blood pressure cuff on, I can turn it on, but it doesn't cycle until I actually hit the measuring. But again, the learner can actually activate from the bedside if they have a touch screen. So once those monitors are on, I'm going to go back, and I'm going to go back again. Now I want to watch those learners and go back to that event menu, and then just whatever the learner does, I will click through those events. So if they start an IV on my patient, I put the IV. If they put oxygen on, just know that in manual mode, that doesn't cause any kind of change to our patient condition. If I wanted the patient's condition to change from putting the oxygen on, I would either go back and change my state, or I do have the ability to touch on the SpO2, and I could make a change right there. If they call respiratory therapy, I can go ahead and click that. In this particular theme, it's manual mode. So if they order any kind of labs or x-rays or anything like that, I would either have to have those resources pulled up on a separate computer, or I could have them printed out and hand them in. So with the SimPad, I don't have the ability to automatically transfer those onto the monitor. I'm going to go ahead and prepare for intubation. So I'm going to activate that state. And you can see there was a clock set for that one, so it's gradually changing, and go back to my gloved hand. So here's the preparing for intubation. And under the disposition options, I've got the IVs going, and I probably want to give a little sedation when I'm going to intubate my patient. When they get that tube in, I get my patient intubated, I will go ahead and click the event in the intubate. So it's very good. You saw I go back and forth to get familiar with what's in your event menu. Going to use that. Those don't cause a change to the page, just for your debriefing purposes, and it will timestamp it. So now that my patient's intubated, I'm going to go back and I'm going to choose my last state, which I have looked at already, and I know that that's going to cause our patient to improve. So I'm going to activate that state and then go back to the event menu, and I'm going to do our post-intubation care. I want to check placement, and as my patient stabilizes, I go ahead and call and give report for that transfer. So I do that much quicker than your learners probably would. So you'll have time to go back and forth and click those events off. But as your session ends, you'll go ahead and end your session here. And then you can actually pull the log up right on the SimPad. And that allows you to see everything that you clicked off that event menu. So you can talk about what they did and why they did it and when they did it. And you can go ahead and use that log for debriefing. If you want the patient information, you can go ahead and put the detail on at the top. And it will give you all of the vital signs and everything that was set on that Manikin during that session. And you can use that for debriefing, or you can upload that log and keep it as a record of their participation. So now that I've shown you how to run a theme in the manual mode, I'm going to actually go ahead and show you how to upload that theme from the Laerdal website onto your SimPad.
To transfer the COVID theme from the Laerdal website onto the SimPad, the first thing you need to do is turn the SimPad on and wait for it to come up to the home screen. Then you'll connect your micro USB into the SimPad and the USB cable into your computer. Once the SimPad is plugged in, the screen's going to gray out. You can minimize the SimPad if it pops up. And from the Laerdal.com website, you're going to go find the SimPad theme, and you're going to hit download theme. You're going to go to the bottom where it says save, hit the drop down and do save as. And then you're going to look for the SimPad in the list on the left. And when you click on it, you want to go into the theme folder. Double click to open that folder and hit save. You have now just moved the SimPad theme from the Laerdal website onto your SimPad. You can disconnect your SimPad, and now your theme will be in the manual mode and ready to run.
All right. So we are going to be providing a resource document that will have the step-by-step for how to transfer that, as well as the resources that were in the presentation today. But does anyone have any questions about running a theme or about uploading that theme to their SimPad? If you do, please put those in the chat, and Clint will rely on you to ask those if we need to.
Okay, Kelly's been answering some of those.
Okay.
There is one, Donna De Silva. Donna and I know each other well. Yes, you can definitely reach out to me. We can do some live streaming. Were there any others that we missed? I don't think so.
All right. So where can you get the scenario and the theme? Again, it's on that Laerdal.com. It's a great resource. There's lots of information there. And right now we have a link to the COVID-19 Resource Center where you can download those complimentary scenarios and themes. There's also the webinars that Kelly mentioned and some information on Manikin cleaning and so on. So please check out Laerdal.com for further information. And now back to our host, Clint.
Thank you, Lori. So if everyone can see me, I got my webcam up there. I wanted to tell you something. So first of all, thank you for hanging with us. Again, typically we do these meetings in person, or we do some small online meetings. we're just finding that there's so many people that have the same questions and concerns. Hopefully we can, I know we're kind of throwing this out shotgun to a big variety of people, but hopefully there's some value for you here. I'm going to cover a couple other things really quick here in the last 5 minutes, but one of the things I wanted to show you is, if you could see this, we were thinking of some nice, fabulous prizes to give away here, and we thought about giving away a BMW or a Tesla, but we have Laerdal Iced Pear Hand Sanitizer, which under current market conditions is worth 3 Teslas and a BMW. So we have randomly chosen 3 lucky winners from all of you, and I'm receiving those right now, and we are actually going to send you some of this nice Laerdal hand sanitizer. And hopefully my Vanna White is working on this. So the lucky winners are, drum roll, this is coming in now. We have Sarah Pierce from Cal Baptist University. Congratulations, Sarah. We will have your representative reach out to you and get whatever address you want us to send this to. Then we have Jesse Downs. I know you, Jesse Downs from Alaska Pacific University. And we have one more. We have Tabitha Teal from the University of Arkansas. So wrapping this up, I want to underline 2 things. If you get nothing else out of this meeting, we are here to help you, and we can help you. You don't have to buy anything. You don't have to order anything. If there's something we can help you with, please let us know. Remember the slide I showed you before? We had everything from cameras on there to mannequin heads falling off to BLS and everything in between. Please reach out to us, contact your local representative. We will help you. In the essence of time, I'm going to go over this a little quick, but this is hot off the press. Literally in the last 3 days, this is where I talked about before. Laerdal can now offer you service online. So any of you who need help fixing a mannequin, you need help calibrating something, something's broken. If basically this is Laerdal service technicians, the same guys that would come out to your facility and fix things for you, we can do this online. There's 2 versions of this that we're working on. One of them is essentially you contact your local rep, let them know what you need. Do you need something detailed, high level? Tell us all about it. Is a spring broken, a widget? And Laerdal will prepare a 2-hour-long under the hood presentation specifically for you to walk you through your mannequin. If you want to go baseline, we can do that, just a standard thing. If you want to go bigger and badder, apart from your under the hood presentation, we can do a customized service visit for you. It's a virtual visit. There is a cost on that just because we're literally pulling technicians out of the field in order to provide that service to you. But this is not something Laerdal's trying to come in and gouge you for money in a hard time. It's just the opposite. They're giving us permission during the COVID-19 outbreak. They're going to take 50% off of any regular in-person service that we now will do with you over the internet. And we can be extremely flexible on this. If you have an hour on Monday and 3 hours Friday, we can do it like that. If you have 8 hours one day, we can do it like that. You get the idea. Whatever works for you, we will do it with you. And again, this is to help you fix mannequins. So Kelly and Lori did a good job of kind of showing you some of the online education we can do. Just be aware we can do online service. I touched on this earlier. We've had some questions about how do we make up lost clinical times. We were all kind of stuck, left in the lurch. Some of you are already using this. This is called vSim for nursing. Some of you are not. Some of you may have heard of it for the first time right now. In a nutshell, vSim for nursing is an online web-based simulation program. So it's a module that your students can do independently. You can monitor it. You can track their project. It was developed in combination with Walters Kluwer, the publisher, as well as the National League for Nursing, contains National League for Nursing content. And it covers everything from gerontology to med-surg to pharmacology, peds. Basically, what people have done as they got caught with no clinical time is they've been able to get licenses for their students, and then your students can do these virtual online simulated modules right from the comfort of their home on their computer. And if you have one student who still needs 3 hours of med-surg, somebody else needs 5 hours of peds, whatever it is, we can get you the licenses you need so that you can give each individual student whatever clinical time they need. There is a lot of discussion out there on the state level as to how many clinical hours simulation can make up. In general, we're kind of finding similar discussions with vSim, and it varies state by state. But again, get in touch with your local representative. We will help you. We'll share as much information as we have with you. Laerdal Scenario Cloud. Some of you were asking questions about SimStore and about updates. SimStore was basically the equivalent of iTunes Store meets simulation. So it was a big online store for scenarios, X-rays, SimPad themes, that kind of thing. Laerdal has actually kind of come up with technology. So all of you are familiar with Amazon Music, Disney Plus, Spotify. Those are all services where basically you pay one annual fee and then you can stream or download your heart's content. Laerdal Scenario Cloud, I am very, very happy to tell you, is that same idea. So in the past, you would have had to buy everything by the one each. So if you wanted to find an asthma scenario to run on your nursing and simulator, you would have gone on SimStore, made an account, and you would have bought that one little scenario. Well, now basically you just pay one annual fee, and everyone at your facility, or just 5 people at your facility, 10, however many you want, we have different licenses. You pay an annual fee and you get access to the entire SimStore. So thousands and thousands of x-rays and waveforms and whooping cough sounds, malignant hyperthermia, whatever it is, any scenario you can imagine, it's all there. And you can get that. I'm not here to sell you that, so that's just an overview. If you want more information on that, let us know. So we've covered a lot. We don't have a lot of time. We're actually over. And we already had the lucky hand sanitizer winners. So if you don't know who your Laerdal rep is, you have a question, a comment. Again, we're kind of doing our best on this. This was a first for us to try something this large scale on the West Coast. Send me an email if you have any questions. I can have the appropriate Laerdal rep get back with you. We'd love to get your comments. We really appreciate everyone participating on this. Stay safe. This too shall pass. Happy Good Friday. Happy Passover. Happy Easter. Happy weekend. Everyone be happy. We sure appreciate you. Anything we can help with, please let us know. We're here for you. Thank you, everyone. Please take care.